Good day, MCS students. I am your nurse Joshua, your school nurse, and I am here to discuss about the different rainy season illnesses. So tara, alamin natin. Ayon sa DOH Health Advisory, tandaan ang salitang wild patungkol sa different rainy season illnesses. W para sa waterborne infectious diseases, I para sa influenza, L para sa leptospirosis, at D para sa dengue. Waterborne infectious diseases. Waterborne diseases are any illness caused by drinking water contaminated by human or animal feces, which contain pathogenic microorganisms. This contaminated water can cause diarrheal diseases that include several species of the Salmonella and Shigella bacteria, cholera, hepatitis A, and typhoid fever. Waterborne and foodborne diseases are transmitted by ingestion of contaminated food water. So mahalaga na ang inumin nating tubig sa bahay ay malinis, ganun na rin ang lalagyan nito. How to prevent having waterborne infectious diseases. First, always wash hands before and after preparing food or eating. Second, sanitary sewage disposal. Third, proper waste disposal. Fourth, drink only filtered or boiled water. Fifth, store water in a clean container. And last, practice good personal hygiene. So napaka-importante na lagi tayo nabubugas ng kamay bago at pagkatapos kumain. Ganun din naman ang paglilinis ng mga lalagyan natin ng inumin at ang tamang pagtatapon ng basura. I for influenza. Influenza or flu is transmitted by droplets that enters the body through the nose or mouth. It can likewise pass from the hand to the nose or mouth by touching contaminated objects. It is characterized by cold-like symptoms plus body and headaches. So ang flu or trangkaso sa Tagalog ay madaling makahawa. So kapag tayo ay nagkaroon ng trangkaso or ang kasamahan natin sa bahay ay nagkaroon ng trangkaso, ay marapat lamang na tayo ay dumistansya muna. May ibibigay tayo o ipapasa tayong bagay sa nasabing tao, ay mas maganda kung isa-sanitize ito at palagi pa rin tayong mag-hugas ng kamay. Symptoms of influenza. Symptoms of influenza which can come on suddenly includes the following: fever and chills, lagnat, cough, sore throat, and a runny or stuffed nose, ubo at pangangati ng lalamunan, headache, sakit ng ulo, body aches and pain, pananakit ng katawan, weakness and tiredness, o labis na panghihina. Ano ba ang treatment for influenza? So people with flu are advised to magpahinga ng marami at mabuti, uminom ng maraming tubig. At ganun din naman kung kailangan na uminom ng gamot para sa lagnat o para sa pananakit ng katawan. Prevention for influenza. Influenza can be prevented by getting an annual influenza vaccination. And if you develop flu symptoms, you should follow basic hygiene practices to avoid spreading the disease to other people. First, again, wash hands regularly and thoroughly or use an alcohol-based hand rub. Second, avoid touching your eyes, nose, or mouth. Third, avoid sharing, eating, or drinking utensils. And last, stay away from work or school for as long as you have symptoms. Kapag may influenza, ay palagi tayo maghugas ng kamay, iwasan ng paghawak sa parte ng ating mukha, iwasan din ang pag-share muna sa ating mga kapamilya ng ating mga pagkain at magpahinga muna sa bahay as long as may nararamdaman. Leptospirosis. Humans usually acquire leptospirosis when they get in contact with water or soil that has been contaminated with the urine of an infected animal. So what are the symptoms of leptospirosis? High fever, headache, muscle aches, especially on the calf o yung nasa likod ng ating binti, abdominal pain, nausea and vomiting, red eyes and chills, and in its severe form, leptospirosis can also cause kidney damage to the liver, also to the respiratory system that may cause respiratory failure and meningitis. Treatment for leptospirosis. It is very important to have an early recognition and treatment within 2 days of illness to prevent further complications of leptospirosis. So, kapag nakaramdam na kayo or lumusong kayo sa baha at may sugat kayo, ay mas maganda na magpakonsulta na kaagad kapag may naramdaman. Antibiotics newly prescribed by a physician dahil ang antibiotics ay nire-reseta lamang ng ating mga doktor sa mga espesyal na okasyon. Prevention and control. Avoid swimming or bathing in potentially contaminated water or flood water. Iwasan lumusong sa baha, mga bata. Use of proper protection like boots and gloves when work requires exposure to contaminated water. Kung hindi maiiwasan na lumusong sa baha, ay gumamit ng bota at gloves. Drain potentially contaminated water when possible. Kung meron kayong nakikita sa inyong bahay na tubig na natatambak na, ay mas maganda na ituro kay mommy or daddy para ito ay maitapon na at hindi maging stagnant. Control rats in the household by using rat traps or rat poison. Maintaining cleanliness in the house. So mahalaga rin ang environmental sanitation sa pagkontrol ng leptospirosis. P for dengue. Dengue fever and dengue hemorrhagic fever are acute viral infections that affect infants, young children, and adults. So the cause of the dengue fever is the bite of an Aedes aegypti mosquito infected with any one of the 4 dengue viruses. Paano ba ito natatransmit? It is transmitted by a day-biting mosquito called the Aedes aegypti and the Aedes albopicus. These mosquitoes lay eggs in clear and stagnant water found in mostly flower bases, cans, rain barrels, old barrel rubber tires, and etc. The adult mosquitoes rest in dark places of the house. Kaya katulad din ng sinabi natin sa leptospirosis, sa dengue mahalaga rin na kung meron naman naka-imbak na tubig sa ating bahay, ay sabihin natin sa ating magulang or kasama upang maitapon agad ito at hindi maging stagnant at pamahayan ng mga lamok or ng mga daga. Ano ba ang mga signs and symptoms of dengue? Sudden onset of high fever, which may last from 2 to 7 days. Joint and muscle pain and pain behind the eyes. Weakness. Skin rashes. Nose bleeding when fever starts to subside. Abdominal pain. Vomiting or coffee-colored na matter. Dark-colored stools. And difficulty of breathing. What are the treatment that is given to dengue fever? First, do not give aspirin for fever. Second, give sufficient amount of water or rehydrate a dengue suspect. And third, if fever or symptoms persist for 2 or more days, bring the patient to the nearest hospital. So sa dengue, mahalaga na kapag naramdaman natin ang mga signs and symptoms na nabanggit, ay i-observe na natin ang ating temperatura at kung tuloy-tuloy ito ay magpa-konsulta na sa pinakamalapit na ospital. Paano ba ma-prevent at makokontrol ang pagkakaroon ng dengue? So, tandaan lamang ang 4S. Una, search and destroy. Cover with the water drums and pails. Replace water in flower vases once a week. Clean gutters of leaves and debris. Collect and dispose all unusable tin cans, jars, bottles and other items that can collect and hold water. Second S, self-protection measures. So wear long pants and long sleeve shirt. Use mosquito repellent every day. Third S, seek early consultation. Consult the doctors immediately if ever persists after 2 days and may mga rashes na mag-appear. And fourth S is say yes to fogging when there is an impending outbreak or a hotspot. So tandaan ng 4S para sa prevention and control ng dengue. Una, search and destroy. Pangalawa, self-protection measures. Pangatlo, seek early consultation. And pang-apat, say yes to fogging. Ayan mga bata, ayan ang mga rainy season illnesses na madalas nating ma-encounter, lalo na ngayon nag-uulan. Kaya tayo ay mag-ingat, laging maghugas ng kamay, at tingnan ang ating kapaligiran para sa mga potensyal na mga bagay na maaaring magdulot sa ating ng sakit. Muli, ako ang inyong Nurse Joshua, ang inyong school nurse. Naway kayo may natutunan sa ating diskusyon ngayong araw. Maraming salamat at mag-ingat tayong lahat.